Okay, now we're going to talk about staffing standards. Staffing standards, when you get into 59A, is long. We break it up into sections. So if you have 59A pulled up, just follow us. We're just going to cover a little section here. So let's go ahead and open 59A on the Word doc, because I think it's way easier to find things.
There's a lot of test questions that could potentially come from this section too.
Yeah, I know I've shown you all this before, but let's just start at the top. We're in the Word doc that you downloaded right from the state's website. In the search box, you're going to go ahead and, let's see if I can widen this. Anyway, you'll just go ahead and type in staffing standards. You can't see that on my thing. And it'll pull up to this section. Okay. So, staffing standards. Administrators, every facility must be under the supervision of an administrator who is responsible for the operation and maintenance of the facility, including the management of all staff and the provision of appropriate care to all residents as required. Okay?
An administrator must be at least 21 years of age, if employed on or after October 30th, 1995, have at a minimum a high school diploma or GED.
Which is everybody. Don't you think almost everybody's hired after that date at this point?
Oh, yeah. I'm like, what are you talking about?
Okay, go ahead. Number 3.
It's still in there.
Yeah, right.
Be in compliance with level 2 background screening requirements. Complete the core training and core competency test requirements no later than 90 days after becoming employed as a facility administrator. Administrators who attend core training prior to July 1st, 1997 are not required to take the competency test.
Which is almost nobody.
Specified elsewhere in this rule. So what that means is you could actually get hired and start working as an administrator or executive director. You can, within that 90-day period after initially being hired, take the core class and pass the state exam, and you're still safe.
Yeah, not the best way to do it in case somebody fails. If you put an administrator in place, people do it all the time. Let's say your current executive director just quits, or you have to fire them for whatever reason. You don't have anybody in place. That's why the rule is in place, that it gives you some flexibility. But you need to be on top of that person to make sure, maybe even have a backup person going through core training as well. Maybe even put somebody at a lower level just in case, like a nurse or somebody as well that will just maintain, or an owner. Maybe the owner should have the administrator license, and there's always that fallback in between. Okay?
When we had our facility, Clay and I both had it. Our maintenance man had it, the core training. Our manager had the core training.
Your
mom had the core training. So we always had some sort of a backup, just because you just don't know. But it's good to offer as many people as you can the training and get them trained and pass the test.
Well, it helped that you were the trainer.
Well, we make it affordable.
We do make it affordable, and they all passed on the first time, which, that's pretty awesome. So no pressure on you then. Okay.
All right. They must, satisfy
number 5.
Satisfy the continuing education requirements. Administrators who are not in compliance with these requirements must retake the core training and core competency test requirements in effect on the date that the non-compliance is discovered by the agency or department.
I know this one bothers you, and we're going to cover it again in the training standards. How many calls do you get, Cheryl?
Yes, oh my goodness.
And we get a lot of calls from people saying, oh, I didn't complete my continuing education requirements. Can I take it now? My license date was 30 days ago.
Right. So you only have 2 years to take the 12-hour CEUs. And if you don't take it within if you don't take it within the 2 years, then you have to retake everything again. So don't be that person, because sometimes I get 5-6 calls a day with the same.
And they're like, well, can't you just give me a certificate? No, we can't.
No.
We can't commit fraud. Sorry. And if the license date, it's based on your license date. Okay. So when you get your license, by that date, every 2 years within that time period, right? you have to get 12 hours of continuing education. Our website makes it easy because you get actually a 12-hour certificate. If you got training an hour here, 2 hours here, 3 hours there, you have to make sure they all fall within that 2-year window. And it can get a little confusing, not just for you, but also, I think, for state inspectors when they come in and they're trying to patch it together. So I think 12 hours is convenient.
So the A 1 through 5, there's several potential test questions there, so be very familiar and know this section.
B?
B.
In the event of extenuating circumstances such as death of a facility administrator, the agency may permit an individual who otherwise would not satisfy the training requirements above to temporarily serve as a facility administrator for a period not to exceed 90 days. During the 90-day period, the individual temporarily serving as a facility administrator must, A, this is where we talked about it previously, complete the core training, core competency tests requirements, and then complete all additional requirements in the facility maintains licensure. If the facility maintains licensure as an ECC or limited mental health facility. C, administrators may supervise a maximum of either 3 assisted living facilities or a group of facilities on a single campus, providing housing and healthcare administrators who supervise more than one facility must appoint in writing a separate manager for each facility. However, an administrator supervising a maximum of 3 assisted living facilities, each licensed for 16 or fewer beds, all within 15-mile radius of each other, is only required to appoint 2 managers to assist in the operation and maintenance of those facilities. So go ahead and repeat that in a simpler term, Cheryl. Basically, you can do 3 facilities, right, if they're within a certain radius and they're under 16 or fewer beds.
And highlight section C because there will be a test question on that one. There may be 2 different scenarios right in that section too.
Yeah, so let's just reread that again together now. The test question could be Mary Jane is the administrator of a group of facilities. They are, 20 miles apart. Or it could say how many miles apart must they be? Something like that. They could throw a scenario at you. So administrators may supervise a maximum of either 3 assisted living facilities or a group of facilities on a single campus. Okay. However, an administrator supervising a maximum of 3 assisted living facilities, each licensed for 16 or fewer, and all within a 15-mile radius, is only required to appoint 2 managers to assist. So basically, administrator of 1 and 2 managers equals 3. Otherwise, if they're above 15 miles, they'd have to be a manager at each location plus the administrator. Okay? Test question. C? Or D? Yeah, it was D. Okay.
An individual serving as a manager must satisfy the same qualifications, background screening, core training, and competency test requirements, and continuing education requirements as an administrator. Managers who attend the core training program prior to April 20th, 1998 are not required to take the competency test unless specified elsewhere in this rule. In addition, a manager may not serve as a manager of more than a single facility except as provided in paragraph 1 of this rule, and may not simultaneously serve as an administrator of any other facility.
Yeah. Okay.
So managers need to have core training too.
Managers need core training. Yep. So if you have a group of 3 homes and they are over 15 miles apart, you will need a manager at each location. Okay. Facility owners, this is E, facility owners must notify the agency central office. Where do you notify? Who do you notify? Agency central office within 10 days of a change in the facility administrator. And you got to use the notification of change of administrator form, and you can find it right on ACA's website under assisted living facility unit section.
Highlight the 10 days, and that's where your test question would be.
Is it going to be a true or false question, Cheryl?
Yes. No, of course not. It's all multiple choice.
Right.
All scenario-based questions.
Yep. We get a lot of people call us and say, I thought it was true or false. It's not. No question will be true or false. Every trust question will try to throw you off and appear to have multiple answers, okay? So, go ahead, Cheryl.
No, it's your turn.
Oh, my turn. Number 2, staff. Within 30 days after beginning employment, newly hired staff must submit a written statement from a healthcare provider documenting that the individual does not have any signs or symptoms of communicable disease. The examination performed by the healthcare provider must have been conducted no earlier than 6 months before the submission of this statement. Newly hired staff does not include an employee transferring without a break in service from one facility to another when the facility is under the same management or ownership. But if you're hiring somebody from a different facility that's not under the same ownership, and the state, when they look at the resident employee files, they're not going to accept that communicable disease statement. And I think we'll get into TB tests, but they're different, okay? TB test and a communicable disease is a physical done by a healthcare provider. Nothing on that, Cheryl? Oh, next is evidence. Yeah, evidence of negative tuberculosis examination must be documented on an annual basis. So the previous one was communicable disease statement is once, and then a TB test is annual. Documentation provided by the Florida Department of Health or a licensed healthcare provider certifying that there is a shortage of TB testing material satisfies the annual tuberculosis examination requirement. An individual with a positive tuberculosis test must submit a healthcare provider's statement that the individual does not constitute a risk of communicating tuberculosis. Okay, number 2, if any staff has or is suspected of having a communicable disease, such individual must be immediately removed from the duties until a written statement is submitted from a healthcare provider indicating that the individual does not constitute a risk of transmitting a communicable disease.
Couple test questions from there. So highlight those sections.
Yep. And the thing is, we're going to keep repeating it, but there's so much information, as you can tell. We don't know. They pull information from everywhere to make up these 100 questions. So the only way to prepare is to really know the information. And whatever scenario they throw at you and say, John had a positive TB test, what would be your steps? Something like that. But okay, administration. This is administration. You will have a large majority of questions coming from this section.
And this is a section that people don't do well on, too.
Mm-hmm.
So it's definitely an important one to look at. Heading down to B, staff must be qualified to perform their assigned duties consistent with their level of education, training, preparation, and experience. Staff providing services requiring licensing or certification must be appropriately licensed or certified. All staff must exercise their responsibilities consistent with their qualifications to observe residents, to document observations on the appropriate residence records, and to report the observations to the resident's healthcare provider. Yeah. So what that means is you can't have a maintenance guy doing medication because that's not what he is licensed to do or certified to do. You can't have a CNA doing nursing duties because they're not the licensed nurse. So make sure that whoever's doing services in your facility is doing them under what they're qualified to do.
Yeah, and then make sure their records are complete with that documentation. Because the state will go around and they'll see, Jane just, assisting with medications. They're going to want to make sure Jane's taking the appropriate training, and then watching how Jane does do the medications. Is it considered assistance with self-administration, which would be quite, is different than administration. So you have to know, that's the big thing about the medication training, is what is the difference between assistance and what is administration.
Right. And with the medication, do not allow anybody to work on the medications until they've had that 6-hour medication course, which is very important and easily to forget, but don't handle medication until that course is taken. That documentation is in their record.
Yep. Let's see here.
We're on C.
C. All staff must comply with the training requirements in Rule 58A, and we'll get to the training requirements in a different section.
That's 59A. It's all right.
They just moved the rule. I know.
We're so used to it.
Okay. Letter D. An assisted living facility contracting to provide services to residents must ensure that individuals providing services are qualified to perform their assigned duties in accordance with this rule. A contract between the facility and the staffing agency or contractor must specifically describe the services the staffing agency or contractor will provide to the residents.
An example?
Yeah, if you use a staffing agency, somebody calls out sick, and most facilities do have some sort of staffing agency on record, on file, on contract. You want to have a contract, and you want to probably pre-screen some of the individuals that would be working with you. Would you think?
Sure.
Maybe before you need them.
Somebody calls in sick 2 hours before
I know,
shift.
and you just got to get
somebody.
somebody.
There's no such thing as screening, but you can find a reputable company. We've had really good luck with staffing companies, and they've sent some great employees over. And they usually come with their own check sheet of the services they provide, and they sign it and you sign it, and then we have a copy for the file. So that's been very helpful too. So it's just really a basic paperwork thing that you need to address.
Yeah, and
make sure you have.
When you call the staffing agency, of course, when you call for when you're setting up your initial call with them, you probably want somebody or a staffing agency that has staff that have experience in a facility, and maybe you can request those people that have already been there. And then you'll want to tell them that the services, let's say Jane called in sick, you need to call a staffing agency. Jane's responsibilities are medication or whatever it is. Then you want to ask them for somebody that can help with medications. But you're going to pay a higher dollar for those people. So if you can shift people over from within your facility to help with medications and bring in just a caregiver.
I'll give you a consulting tip too.
Yeah.
Or, well, it's not necessarily consulting. Do not try to hire them and poach their staff without reading your contract, because some of the contracts say that you'll have to pay $2,000, $4,000, $5,000 to bring that staff person over. So be really careful about that. And
you feel bad because sometimes those staffing agencies don't have they don't give their staff enough hours. Maybe they're subcontractors, so the staffing agency is not paying their taxes. So you like them. It's hard to find good employees, and
some of our best employees we poached from a staffing agency.
Yeah, they warned us.
We didn't know.
They warned us, but we had her for 8 years.
Yeah, she was awesome.
It was really so read your contract and then keep that contract on file. Okay. Next.
Is the facilities with a licensed capacity of 17 or more residents, the facility must do certain things.
This is something to remember. You cross over a threshold when it comes to staffing. But did you notice the distance between the facilities? Wasn't it like 16 or fewer? I know it gets confusing. Yeah. 16 or fewer beds within a 15-mile radius for the administrator and the manager breakdown. And this is 17 or more. So it's really the same, right? Anything above 16.
So what you'll find is there's certain things that you can do under 17 and certain things that you have to do with over 17 residents. So I suggest that you make a list of 16 and under 17 or more. And as we go through the training, start putting bullet points under, and that'll be used as a good study guide. So under the 17 residents or more, this is different than smaller places. You have to develop a written job description for each staff position and provide a copy of the job description to each staff member. And you must maintain timesheets for all staff.
Yeah, so they'll definitely check your job description.
Yes.
But it doesn't have to be very much, just something.
Well, I just found something online and just copied it right there. Very, very basic, just so you have that in your files. They will look for that when they audit your files?
Timesheets, that's simple. You probably have some way of, them tracking their hours. F, level 2 background screening must be conducted for staff, including staff contracted by the facility to provide services pursuant to 408. Okay, so everybody needs level 2 background screening, even the people that you contract. You might want to check that. It's a $500 fine for every person that is not background checked. And there's also a fine too if you don't add them to the screening roster. I think we'll talk about that later. So that's it for this section. Is there anything else you want to cover?
That's it.
Okay.